us discuss about meneires disease. Meneires disease is also called endolymphatic eye drops. Let's see what is this meneires disease. Meneires disease is a disorder of inner ear. It is a disorder of inner ear in which endolymphatic system system is distended with distended with endolymph. Let's understand this. Here in the inner ear we have two fluids. They are perilymph and endolymph. Clear? In this disorder, what is happening is there is excess endolymph. There is excess endolymph. Why there is excess endolymph? Mainly two reasons for this. One is increased production. Other one is decreased absorption. Let's try to understand these two concepts: increased production and decreased absorption. So, what are the causes? One is increased production. Other one is decreased absorption. Clear? So, first, why there is increased production? First, we have to understand from where does this endolymph is produced. Endolymph is produced from stria vascularis. Clear? So, there is something wrong with this stria vascularis that results in increased production. What is that wrong? See, when there is decreased oxygen, or we can say hypoxia, to this stria vascularis, it results in vasodilation. Due to this vasodilation, there is increased escape of fluid, right? Increased escape of fluid, and that results in increased production of endolymph. Clear? So, what is happening to stria vascularis? There is decreased oxygen, or otherwise we can say hypoxia to stria vascularis, that results in vasodilation, that ultimately results in increased production of endolymph. Clear? Then the second reason is decreased absorption. First, we have to understand from where does endolymph is absorbed. Endolymph is absorbed by endolymphatic sac. When there is decreased blood supply to this endolymphatic sac, it results in decreased absorption, because ultimately it has to get absorbed into blood, right? So when there is decreased blood supply, then ultimately it results in increased retention of endolymph, right? That results in increased endolymph. Clear? These are the two important causes. What could be the other causes? Other minor causes. Allergy causes, as all of us know, vasodilation. So it results in excess endolymph production. Other one is sodium and water retention. Hypothyroidism. Other one is autoimmune and viral etiologies. Clear? These are the other minor causes. And one more important cause is vasomotor disturbances. What happens in vasomotor disturbances? Let's see. In vasomotor disturbances, what happens is there is increased sympathetic activity. Due to this increased sympathetic activity, there is vasoconstriction of internal artery. Vasoconstriction of internal auditory artery. Due to this, there is disturbance in vestibular epithelium and cochlear epithelium. This results in vertigo and deafness. Okay, so these vertigo and deafness are seen in meninges disease. The main cause is due to vasomotor disturbances. Clear? So let's revise the causes. The causes are increased production. Why there is increased production? Due to hypoxia of stria vascularis. Clear? Decreased absorption. Why there is decreased absorption? Because hypoperfusion of endolymphatic sac, allergy. Then sodium and water retention. Other one is hypothyroidism. Other causes autoimmune and viral etiologies. Clear? These are the causes of meninges disease. As all of us know, we have seen how there is increased insulin production. What happens when there is increased insulin? Let's see what happens when there is increased insulin. First, let's see the diagram of cochlea, cross section of cochlea. This is cross section of cochlea. Here we have stria vascularis. This is Reisner's membrane. Here we have endolymph. Clear? This is scala vestibuli. So when there is increased endolymph, what happens is this Reisner's membrane will bulge into scala vestibuli like this, right? Sometime it gets ruptured. Okay, it ruptures. Due to this, what happens? This endolymph will mix with perilymph in the scala vestibuli. In the scala vestibuli, we have perilymph, right? When this Reisner's membrane ruptures, this endolymph will mixes with perilymph. Due to mixing of this perilymph and endolymph, it results in vertigo. Clear? So now you should know why there is vertigo in meninges disease. The reasons for vertigo is mixing of endolymph and perilymph. Clear? Now, other symptom is hearing loss. Here, this hearing loss is fluctuating type of hearing loss. Here we are, when there is episode of vertigo, usually vertigo will be for months, weeks, anything. It's like it comes in episodes. This vertigo, it comes in episodes. So when there is episode of vertigo, there is hearing loss. There is also hearing loss. So suppose we have episode of vertigo and we have hearing loss also. Between this is another episode. Between these two episodes, hearing will be normal. But one important thing we have to remember is, after every episode there is decreased hearing. After hearing loss. As the number of episodes increases, the amount of decrease in hearing loss will increase, right? And that ultimately result in hearing loss. Clear? So this This is how hearing loss leads, right? Next, there is also tinnitus. Tinnitus will also be there, and there will be sense of fullness, sense of fullness in ear. Clear? So, what are the main symptoms? One is vertigo. Which type of vertigo? Episodic type of vertigo. Second symptom is hearing loss, or we can say fluctuating type of hearing loss. Third one is we have tinnitus. Tinnitus. Fourth one is sense of fullness. Sense of fullness. Clear? These are all the main important symptoms. Clear? Now let's see the examination, investigations, and diagnosis in next video. Thank you for watching.